So what comes to mind when you think of psychological first aid? You know, a lot of what we talked about last week, what the teens are going through, the stressors, the anxiety and depression. So I invite you to do the same. Share in the chat box. What comes to mind when you think of psychological first aid? All right, stress management, comfort, journal, comfort and reassurance. Very good. Healing to mind, body, and spirit. I love it. I love the total wellness implication. Prayer, breathing exercise, talking, listening, coping skills, anxiety, and listening. Exactly. Pretty much everything that you all mentioned, right on. Stopping bad reaction was another one that I just saw. Just as you would if you had a little cut on your hand, you would apply the Band-Aid on to prevent the your cuts from bleeding. Now, if it's bleeding profusively, you would turn to the emergency room or elevate it to more specialized care. But for the most part, that's sort of containable. So psychological first aid is pretty much the same. It assumes that when people are impacted, in this case, our teens, whether it be homeschooling, social isolation, conflicts at home, missing major milestone, the challenges that they face, and the whole host of what we discussed last week, that when they go through these difficult times, there are certain core actions that people around the teens can do that can help, and that's what we call accompaniment. And many of us as youth ministries, youth leaders, we work with our teens. And if we are able to recognize it and apply some of the principles of psychological first aid that we'll talk about, I think we'll be able to not only understand, be able to connect, and ultimately refer or link the teens to additional services or additional support. And that support can very well be us, can very well be the parish, can very well be the community. And so let's take a little bit dive in terms of what psychological first aid is, right? But before we talk about it, a lot of these stressors that we emphasized from last time, some of the things that our teens go through, and this is only just the tip of the iceberg, and there are many more, as we discussed last time, for a variety of different situations. Now, I know when you hear of psychological first aid, and that's why beginning of this, and I said, don't mind the term so much, because when we think of it, we're like, oh no, this is, requires some specialized skills. Essentially, the reason why I'm doing this as a tool for us to accompany with our teens during this most difficult time. Psychological first aid, it's not, any psychiatric intervention. It's not counseling. It's not psychological debriefing or forensic or clinical interview. None of those, and nor it's any, effort an hour to press our teens to tell us what's wrong with them. What are they going through, just so that we have information. Not at all. One of the reasons why this presentation is done here is really lay people like us. When I mean lay as a non-professional, not lay as a non-clergy, because all of us are lay, non-medical. And if we have this awareness, this understanding, again, as we talk about accompanying our teens, it'll help us significantly so that we can help our teens to allow them to know that we truly understand, or at least we have some capacity to understand what they go through. And in doing so, we'll ensure that they're feeling safe, that they can speak to us and they can trust us. I think a lot of time we fail to prioritize the importance of building rapport, building relationship. There's a reason why a lot of our teens are more comfortable talking to their friends versus going to their parents and kind of be upfront or to really share some of their deep down thoughts and feelings, or even to turn to other adults. Perhaps they feel that they may be judged, perhaps that they feel that they may be treated differently, perhaps whatever the stigma is associated with it. And that there's a reason why they go to their peers, because they feel non-judgmental, they feel they accepted, they feel they can be heard. And so essentially that's what we want to do. If we're going to be successful at accompanying our teens, we have to be able to build that rapport. We have to be able to have our teens come to us. And if they don't, guess what? You can try as much as you want. The bridge hasn't been built. And so therefore we'll have a hard time. And so when our teens going through a difficult time, they need to feel safe. They need to feel that they can be connected with us, and through our interaction with our teens can instill some hope in the challenges they go through. And as we learn to understand what they go through, we may then be able to perhaps refer, connect, or just point them in the right direction so they can get the support that they need. Ultimately, in doing so, they'll be able to help themselves, and eventually they can then be our advocate, our other youth leader. And who knows, we have a lot of teens who end up being youth ministers, so then they can carry on the torch to help others in the community. All right, so with psychological first aid, there are 3 basic principles. It's easy to remember. It's the triple L. Look, listen, link. Look, listen, link. In looking, first, when we work with our teens, we need to make sure that they are safe, right? Obviously, depending on how, if you had some social science background, the Maslow hierarchy of needs, safety, physical safety first, and then we get into the emotional safety, etc. When we recognize the challenges they go through, and we see that they're in distress or they're going through a difficult time, we then approach them. And in approaching our teens, we then have the opportunity to listen, to offer some empathy, and just to inquire about what's going on and how can we help. So this is really the bread and butter of accompaniment, being able to recognize what's going on, to be able to touch base and check in. And then ultimately at the end is be able to either help them resolve the immediate stressors that they're dealing with. And that could be offering some insight, offering some suggestion, or linking them to services. And ultimately in the end, it's to really point them in the direction that they can get the help that they need. So in a nutshell, sort of look, listen, link. It's what we'll talk about today. All right, so first, let's talk about look. So what do we look for? All right. So last week we talked a lot about what stress looked like in our teens, right? So that is, I'm actually setting you up for today. So which is the first step already. So last week we talked a lot about what anxiety looked like, what symptoms of depression look like, what our teens are going through during the pandemic, during COVID, what it looks like if they're missing out their graduations, their prom, their birthday. What does it look like when they're no longer interacting with people? And to be able to look at what someone in distress would look like. All right. So I'll summarize it here a little bit and sort of the 5 domains that all of us can look for. And a lot of this we covered last week, and so I won't spend too much time. But the tips in doing this, or the best way that you can do this is, I tend to believe that all of us as human beings, we have an inherent ability, sorry, phone is ringing, disregard that, an inherent ability to differentiate or to discern when a behavior is beyond what we call the normal baseline, right? So think about this, for example, if you have a spouse, you have a young teenager, and the teen, it's always showing up for your Zoom session, or pre-COVID, they're always at church, they volunteer, they're very engaging, they're very socially active. And then all of a sudden, you see them a day and they're not there as much. They just seem quiet. They're not talking to people. They just want to be by themselves. Right? That's a deviation from the baseline. Immediately, that should tell us right there that something is bothering our teen. Something is bothering our young friend. Or if you have, community members, if you're on, for example, this virtual climate, I have a team member who's constantly participating, very active, and then all of a sudden they're not. And when I check in, and rightly so, there's always something wrong. So naturally, how we are day to day, that's sort of our baseline. And when we deviate from that, and that is an indicator of something is wrong. Those who have taken the lie detector test, and sorry, the line of work that I do, if you were on last time, I shared some of those. If you look at the lie detector test, that's basically the same. It used to be where people do lie detector tests for employee in the intelligence community. It used to be like 10, 15 minutes, the test. But then they realized that people could hold their composure and they're able to beat the lie detector test. And now we're looking at the lie detector test that's about 3-4 hours long. And the idea is sooner or later, you're going to be fatigued out. And then that's when they look at your deviation from the baseline, how you respond. So same thing with our teenagers. We look at their deviation from what of their normal. So what do we look at? So cognitively, and this is where maybe it's my way of quizzing everybody from last week, right? What would be some cognitive sign that our teens may be going through some stressors, some difficulty? Right? And I invite you to share this on the chat if possible. Right? Just some cognitive behavioral observation, or could be behavioral. We'll talk about some cognition. All right. All right. So lack of eating, that's more so on the behavioral side. Okay. Well, heck, how about this? Let's just share all those 5 categories, and I'll just point them in the right category. Okay. All right. Now just look at the chat here. All right. So it's acting out. Very good. So behaviorally, now that you see your teens acting out, impaired concentration, that's on the cognitive domain. They used to be able to think and they're very sharp and they're right on, and now they're not doing so as much. Inability to focus, very good. I love all the responses there. Sign of anxiety, that's on the emotional side. They're more anxious now. They seem to be disengaged. They seem to have a lot of worrying on their speech and on their facial expression. Their appearance has changed, very good. From a physical standpoint, they're more disheveled, right? Or they just seem fatigued. Or if they report that they have sleep disruption, they don't have regular sleep anymore. They have stomach issues. Very good. Appearance has changed. I'm just scrolling down. Disinterest, irritability. Very good. That's another behavioral observation that you see. Agitation, anger, uncharacteristic behavior. Very good. Schoolwork, harmful action. Very good. Behaviors that are indicative of self-harm. Like, yesterday I was interviewing a 12-year-old teenager, and she was talking about, starting to cut her hand with a plastic fork, not really an actual knife. But that was her first interaction. And I would imagine if there's no intervention, if there's no one intervening and checking in, it would then lead to other sharp instruments. So nervous tics. All right, very good. Cutting, depression. Can I just pause for a second and just give you all a lot of accolades? You all are amazing. All the responses, excellent. One, I feel good and I'm blessed and I'm grateful that everyone at least was paying attention last week, or everyone just sort of knows this already. All right? Fear of isolation, very good. Or you may be dealing with this on a regular basis, so that's good to know. All right, very good. So all of this, and something we didn't hear too, maybe alcohol use from a behavioral sense. And if you think that teenagers, 17, 18, don't engage in drinking, I would, maybe they're not telling you. Definitely, that's something that they deal with. Very good. Smoking or other substances. I haven't seen tearful spells. That's always an easy indicator. If you see our teen sitting there, or just as they're telling you, you see tears or watery eyes, that just means that it's invoking some emotions there. Very good. So all of these, and that's an indicator, and this is really in the look, the observation. When you see these behaviors that are a deviation from the norm, or that's something that you don't normally see in that teen, right away, let yourself know, perhaps I should check in, or perhaps I should, have someone else check in if I don't feel comfortable. This is where I think they need us. Okay. All right. So next, let's talk about listening. Okay. And this is really it's going to take a good portion of our time as we talk about how to listen, and then how to offer some immediate support to some of the things that they're going through. As a psychologist, when I help our teens talk about career fairs, and then when they ask you, hey, Dr. Hoying, what do you do for a living? And I just said, well, I just listen to people a lot. And for those of you who know, or if you're in the profession, about 70% of what psychologists or mental health providers do, therapists do, is really we listen. 70% of what we do is be able to sit there and listen, and to listen actively, and to be present, and to convey some empathy, some understanding. So I tell people it's a good job, you know, all you do is sit there and listen 70% of the time, and hopefully, depending where you're at, you're compensated well. So active listening is more than just sitting there and passively looking at the person while the person speaks with you, but really through your nonverbal language, you know, leaning in. And if, you know, I would encourage the diocese, if you haven't already, maybe have a brief training on sort of active listening, attending skills. And especially when we teach, when we work with our youth. And as you've seen me present, and you know, I'm quite the active guy. So I even though I'm virtually, I'm leaning in, looking, and I know sometimes the face can really get into the center of the camera. But I think from folks receiving it, they will know, and they will notice right away that you're interested and you're vested and your energy is directed at the teens. And so part of active listening, it's really being present and being there, and to sort of, you know, acknowledge the things that you're hearing. And that could also be done verbally or non-verbally. And sometimes it may help to paraphrase, or just to, if I can, this is what I'm hearing. And you would repeat that and have the teens sort of either acknowledge that's how he or she is feeling. Because often, sometimes we may not fully know the full story, and due to our preconceived notions and preconceived understanding of our experiences, we then tend to assume that's what's going on. But allow the teens to tell us their story by us being there, being present. And I think that helps. And that helps significantly in letting the teens know that we're there, we're understanding. And now as we listen, and sometimes the teens may not be so forthcoming. And this is where asking questions, asking the right questions may be able to help. And so maybe I'll invite folks here on the line, all of us, you know, as you approach your teens, what are some normal questions? What are some day-to-day questions that you often ask our teens? I'd love to hear or see your thoughts. Go ahead and type in the chat box. So what questions you often ask your teen or approach your teens there in the diocese? How are you today? Very good, thank you. Right, so that's a very common phrase that we hear all the time. Very good, thank you. All right, what was your best thing that happened today? Excellent. On a scale of 1 to 10, how are you and why? Oh, sounds like an interview. Very good. How's it doing? What's going on? How are you? What happened new and exciting? Very good. Anything I can do? Excellent, excellent. Right. And so, you know, here's what's new. Beautiful. How did you spend your day? Very good. What is your favorite class teacher? Right. So I think all of us have our sort of normal approach, how we approach our teens. In accompaniment, in engaging with our youth, I would then invite you know, all of our youth ministers and youth leaders to, you know, what is it, the chef Argosy, or what's his name? Bam, bring it up a notch. I forgot his name, but to bring that up a notch, right? And so even in our communication, Emerald, very good, thank you, Terry. So, you know, bring it up a notch. And so I think naturally, as human being, if I was to ask you, and I guarantee you, we'll do this experiment here. There are 30, 40 of you so here, and want to ask you, you know, how are you today? The common answer is what we'll get is good, right? Well, I'm okay, right? All right. Would that be so? I see a lot of head nods. And so in psychology, I would pause and challenge you. When people say they're good, you know, are they really good? Are they truly good? Are they truly well? Or things are sort of just jolly? And yet we hear it all the time, and yet we stop at that, right? How are you doing? Good, great, done, right? And I think too, for a lot of our youth, our teens, sometimes I think we're conditioned to give that response so that we did the checkbox and that they won't inquire further. Because if you were to say, no, I'm not good, guess what? Now I have to like sit down and talk about all the issues I'm dealing with. And maybe they're not comfortable, maybe they're not ready, and they're just not certain that you understand. And so a lot of time, many of us, as you sit here, you would say good. And that should be the end of it. And so now let's take it up a notch, be like Emerald. And so let's say if you do start with that good, probe on. Next question. Oh, that's exciting. That's good to hear. I'm so glad. What's good? What's going on? What's well? All right. And see now, so now you're engaging. And if our teams cannot tell you what's good, that then will be your indicator. Maybe it's not so good. Maybe they're going through with a lot of struggles. Maybe there are more difficulties that we yet to understand. And if we're going to accompany them, we need to know, right? Or we need to engage with them. So up a notch, if you're going to start with how are you? Let's follow up with another question, okay? And I see a lot of good questions on here that started with what or how. Excellent. I've worked with some other folks who had a lot of a lot of close-ended questions. Did you do this today? Did you do that today? And so when we add close-ended questions, you sort of just mentally are encouraging your teens to just kind of give you a box-in answer. If you were to ask open-ended question, just how are things? What's new? What's happening? What can I help you with? Then you allow the teen to take some time to think. And from a Freudian concept, sort of free association, what they need most is often the first thing that they'll say. And so often it'll be something that they'll tell you. And now we're gonna up it another notch, being Emerald. Be creative in our ways of asking, or this is like check-in. So every time I would do a check-in with our teens when we gather together, I stop asking, how are you? I always start with something else. Well, during this week, who have you encountered that may need our prayers this week? Right? Who this week that we can pray more for? What's a blessing that you received today? What are some way that you see a goodness in your day today? Right? Don't jump up right away, get into God and Mary and Joseph right away. Because usually I find with a lot of teens, yes, but then they sort of pull back. But then as you probe, then you draw the relationship. Well, goodness is God. Right? Goodness is love, right? And then that's how you bridge together with our teens. So I would invite you to take up a notch. And there are many creative ways that you can check in. I see high and lows, very good. We do a high-low check-in, right? And if we know there are certain virtues, certain characteristics that we emphasize, we can start with that. For example, think about times this week that you weren't patient, if we want to talk about patience, right? If we want to talk about charity, think of a time this week, and this is our check-in. So tell me a little bit about this week where you felt someone could use some charity, someone can benefit from some charity that we do. And so I hate to just talk, and so I'll pause here, and now I'm going to invite all of you to think of a check-in question that we can check in with our youth, all right? And you cannot use, how are you today? Okay. All right, go ahead, share in the box. And this is a good way for us to also learn and jot down and use when we interact with our youth later on. What are you grateful for today? Beautiful. Thank you, Terry. All right, others? And be creative. Really, the sky is literally the limit. Reach for the sky. My daughter's name is Sky, so every time I say that, she starts touching herself. She's like, oh, Sky. All right. Where did you see God this week? Beautiful, beautiful, Catherine. What was your favorite thing this week? Excellent. And why? Who has made you smile today? Very good, very good. I'm sure there are more other thoughts that I didn't hear yet from those who didn't get a chance to respond. Go ahead, jot in a sentence or two. And I heard someone said, well, if you could meet any saint, who would it be? All right. Here's a question that we ask our kids to pray all the time, but maybe we could check. Well, if Jesus was right here, physically in the physical form with you, if you can ask him any question, what would that be? All right. If you can meet any deceased people in history, who would you like to meet and why? Right. And so probe on. Right, music you've been listening to. What has made you smile today? Excellent, Margaret. Love it, love it. Were you able to reach out and do something good for someone this week? All right, very good. I would start with what, because that's sort of like a close-ended question. Like, were you? And the answer is either yes or no. But maybe probe a little bit further. Where are you today? Excellent, excellent. So I think everyone got the point. What was your least favorite part of the day? Have you had a chance to help your friend? Excellent. A little bit close-ended, but do open-ended. Tell me 3 things that you're grateful for. Beautiful, beautiful. You're ahead of the game today with all this gratefulness talk. So we'll chat a little bit about that. So excellent. So asking the right questions, right? And sometimes asking the right questions can also help you to understand what may be going through, such as, how can I help you? How can I help? Normally you're very active and outgoing, and I see you not as active as you normally would. I'm just wondering if there's anything going on, right? What may be a worry for you as you're going through COVID, as you're going through the pandemic? Or if you sense your teens is telling you and not really follow through, or they're alluding to something, something to the extent of, I get the sense that that there's something more in your mind. Let's talk about it. Or if you're getting the sense that the teens is telling you multiple things and you just don't know where to start, maybe just kind of narrow it down. What are the most important issues I can help you with? If we can talk about just one thing that we can work on, what would that be? A solution-focused question that I often use a lot in my interview, or what we call the miracle question, the miracle or the magic wand question, depending on how the ways you want to do it. So if I'm working with Catholic kids, I would then tie it to our religion. Sometimes when we pray to the Holy Spirit, if we could pray for one thing that the Holy Spirit can give us strength on to deal with, what would that be? And so again, helping our teens to kind of narrow down and focus on with it. All right. Another aspect of the listen component of accompanying with our teen is really this concept of what we call expressing empathy or providing empathy. So if you look at the scientific literature, during this time, how they assess or measure the effectiveness of a therapeutic relationship is on the provider or the one who is accompanying the other sense of empathy and the ability to express empathy. Now, I invite all of you to think back of a time when you're going through something difficult, right? And the feeling that you felt when someone was there with you to talk to you, to what our cliche, a shoulder to lean on, someone that you can text and call and be completely upfront without fearing being judged. Our teens are very much the same. They too are human beings, so they go through the same. So our ability to express empathy, it's extremely important. So, something to the extent, if you could relate, if you could share, if you could understand what they go through, normalize it, because you have gone through it and many others may have. And the whole idea with normalization is you're reassuring the teens that the teen is not alone, that they are within others who share their struggles. And that in itself is already therapeutic. And so, it's okay to feel sad. It's okay to feel angry. It's okay to feel lost during this time of the pandemic. You're not alone. Many people, thank you, many people have this feeling. Many people go through what you go through. And certainly I have gone through, and I'm going through that right now. And perhaps we can go through this together. So that's conveying empathy. And I would imagine you're able to open up as such, you'd be more likely to have the engagement with our teens. When we provide empathy, try, on some extent, if you haven't gone through it, if you don't know what that's like, often we hear at times other folks said, "Oh, I know how you feel," right? It's kind of like in therapy. There was an analogy. We had this millionaire doctor who would drive a Mercedes and he's working with a client who's homeless. A client talking about how difficult life is, and the guy in suit is just sitting there and saying, "Yeah, I know how you feel. it just seemed unauthentic, right? And so if you can relate, especially if the teen's going through grief, going through bullying, going through difficulty with school, with pandemic, with parent at home, if you haven't gone through it, it's okay to say, I haven't gone through that, I haven't experienced that, and I can't fully relate. But as I'm sitting here hearing what you say, and I put myself in your shoe, I can only imagine how difficult that must be. Right? And so by conveying that in itself is authentic. And you're being upfront, you're accompanying with the teens, and then maybe then that's your opportunity to have the teens rather help you to understand what that's like. So I'm quite not there, and I can't really imagine the pain that you go through. Help me to understand a little bit. What is that like, going through what you go through? Most naturally, as we're struggling, we often would want to share some of our struggles. Okay, all right. So those are sort of a little bit in terms of empathy, and hopefully the diocese can put on a couple more attending skill training. Now, I would avoid phrases or statement that would either invalidate their thoughts or feeling. I would avoid statement that would be sort of judgmental in nature. What we want to do is validate their feeling, not the other way around. And so I would avoid things such as, "Oh, don't feel bad. Oh, don't cry." For many of us, crying is very cathartic in itself. A practice I often use when I see people crying, I think many of us get this knee-jerk reaction of needing to grab a tissue right away and say, "Here." Now, people may think different. To me, I see crying as an authentic expression of emotion, and I think that's good. I see crying as cathartic in itself. So when I see people crying, I would just sit there and be comfortable and be okay, and actually invite them to cry. So if your teens are doing that, allow them to. Now, the tissue, you don't have to give it to them, because I think giving people tissue, and you may believe it differently, it's sort of kind of tell them, okay, stop crying, wipe your tears. I would just leave the tissue right in front of the teens, or leave it within reach. And if the teen is ready and they want to grab the tissue, then they'll do it on their own. But don't just insist, "Here, take it, wipe." Very good. I see Stacy. Let them share their feeling. Unless they're drooling down burger and other things, and yes, go ahead, tell them. But yeah, allow them to express. So avoid things like that. Avoid trying to say things that, "Oh, try not to think about it." In our mind, because if we tell them not to think about it, we assume that they're not going to think about it and things are going to go away. Well, I'll invite all of you to do this right now. Try not to think about it. In the next 10, 15 seconds, try not to think about Mr. Young Huang sitting in front of you. Don't think about me. Don't think about me. Guess what happened? You can't, right? Automatically, you tell people to not do something, they're going to do it, right? So avoid things that would invalidate that. I know we're Catholic and all, and don't say, it's God's will. That's what happened. It's God's will. It's God's will. Maybe our teens are not at that level to fully understand the full theology of human suffering, what it means. And so for us to say, "Hey, it's God's will," I think they can interpret that as, maybe this is not the right place for me to be, right? And we'll talk about next week in terms of how we talk about religion with our youth, how we talk about suffering, how we talk about what it means to be invited into this redemptive effort of the salvation of the world. So we'll talk about that next week, and avoid any why statement. Well, why did you do that? Or why did you feel this way? Why did you think so? And again, why just seem accusatory in nature, right? And it's very judgmental, in my opinion. So avoid why statement. Okay. I truly believe that any why question you want to ask, you can ask with what. It's going to help, right? Why did you do that, right? You can start with what. Well, help me understand what led you to act out that way. What led you to behave in that way? See, instead of why. Instead, now we're inviting. Well, why are you crying? Versus, help me understand a little bit. What's driving some of that emotion that I'm seeing right now? Right? So things like that would help to engage. Because the minute you say why, it's sort of kind of like a wall, a barrier to shut down. Okay. All right. So that's a little bit in listening. So that's us being able to have attending skills, to sit there, to listen, to ask questions, to express empathy, and obviously to avoid some of the things that we shouldn't be saying that would convey sort of a demeaning tone. Now, the next step here, I'll talk a little bit about some effective ways that we can help our teens cope with the challenges that they face right now in the world. And a lot of these are some of the questions that you've raised last week. So as the teens are dealing with this sort of uncertainty, this pandemic, this COVID, things they've never seen before, right? Just reassure our teens. And we have to be good models of this, to let them know that it's okay to feel what they feel, the sadness, the anger, the frustration, because it is normal. Actually, I share this a lot with the folks I work with, a lot with our teens. Actually, it is abnormal. You are not normal if none of this impact you at all. If you're going through COVID and the pandemic and all the things that we talked about last week, and you said, I'm fine, I am great, none of this bothers me, then I really think maybe we could have further dialogue. But it is quite normal. And really, the new norm now, or the new normal now, is sort of all this uncertainty, all these things changing all the time. We're on this third variant strain. Who knows, by winter we may have the fifth, the sixth. I don't know. There's always new guidelines coming out every day with CDC and school regulation, diocese regulations. And so constantly things are changing. But that's not new with our teens. We just need to remind them that. Many of them go through uncertainty all the time. Going through puberty, going through the different stages of their development. That's changed all the time. They're so accustomed to getting to a new school, making new friends, and going through a different routine, a different schedule every day, meeting new friends, leaving new friends, doing many different things. And so remind them too that they do have what it takes, because they are equipped, all of us. We have been built to have the internal resiliency to adapt to change, because change is inevitable. If you look all around us, everything, there's always a change process in the works. And so sort of allow our teens to know that this is too a part of the new norm, is what they go through. And it is what it's happening on a daily basis. Another aspect is, because of this, when we talk about uncertainty, really the root of uncertainty, of all the unknown, all the things that's going on, is the fact that we have no control over it, right? When you think about it, it's uncertain because we don't know. And we always say knowledge is power, right? The more we know, the better it is that we're equipped to do what we do. And when we don't know, that puts us in a lot of, a state of constant worry. And I think for the most part, many of us, we turn to worrying as a tool to cope with the anxiety. Somehow, somewhere in the back of our head, we just believe that if we dread enough, we worry enough, that the problem is going to miraculously go away, that we'll find a solution. And when we worry, our teens then worry, because they see that from us. Our parents, the school, the church, were sort of this secondary agent of socialization. They learn it from home. That's their primary. But when they interact with the community, the school, the church, we now then become their secondary agent of socialization. They learn from us. And so how we model is how they'll learn from it. And so, worrying, we think about it, but in actuality, worrying makes things worse. Worrying doesn't resolve anything. Actually, it makes you, if you look at most mental health concern, worrying or stress is a key component of the symptoms. And so instead of worrying about things you can't control, the uncertainty and the pandemic, things happening, let's focus on things that we can control. So remind our teens again that we do have a lot of control over the current state of life right now. Keep a routine, keep a structured day, because the structure, the day, knowing what to do, and as trivial as the time you get up, the time you eat, the time you program your day to have some exercise, some leisure time, some recreation time, prayer time. Keep that as consistent as possible, because the more of a structured routine that you have, the better it is that the team will feel that they're in control. Then they're more likely to cope with the changes that are going on. What else can you control? You can't control the spread of the pandemic. If medical is a concern for you, what we can control is our constant hand washing, right? Keep your hands clean. Prior to this, practice safe social distancing. If you're now vaccinated, the guidelines, you don't have to, but if you haven't, you wear a mask, keep clean, cough into your elbow. I don't know if that guidelines has changed, but it seems to change all the time. But practice what you can control from a hygiene aspect. Eat regularly. And nutrition is one of the key way to give you strong immune system. And with strong immune system, you can ward off some of the symptoms with COVID. Right? Volunteer. These are things that you can do. Take up, help others. I think last week I mentioned about altruism. It's sort of when we do good for others, it's sort of this food for the soul. All of us can benefit from, and similarly with our teens. So they can help volunteer, they can go help nursing home, and we've done it within our youth ministry. We had our teens write letters to a lot of the seniors citizen who are in nursing home because they can't interact with people, and that itself gave them a sense of pride and contribution and identity. We encourage our teens to utilize those with talents, those who can sing, who can play a musical instrument, who can dance. They did a short 60-second video of them performing, and we kind of piece all of this together, and we send it to the prison, folks who are going through a hard time, and we end up helping them in that capacity. Many different things you can do. Be creative in what you can do. Take up new skills. This is what I encourage a lot of teens. I'm sure many of us, all of us, as teenagers included, there is some skills that something that we want to know, something that we want to do, something that we want to learn, but we haven't had the opportunity at the time to. Well, this is the most, I think this is a blessing in itself to have the time. I was able to speak with a 12th grader. She downloaded, Duolingo, this free language app on her phone. And she was using it like 5 minutes every day for the entire year. And she got this little, the icon saying that you did for 365 years. And now she's just speaking Spanish like left and right. That itself, it's amazing. So, maybe challenge your team to do so. And as you organize your youth ministry, your youth group, have that be an effort that you do every week. It really takes some teamwork to pull folks together. And then the other piece is form your own peer, social support group that you can do. And that's what, we'll talk about this next slide here. I think we often think about quarantine and social isolation, social distancing as zero communication, where in fact, that's not at all it. It doesn't say no social engagement. And I think with the technology that we have available, I think that we can capitalize on it. And to the extent possible, make good use of it. So if you're in the diocese here in New Jersey, maybe connect with the youth ministry in another diocese. Do pen pal, do our virtual sort of prayer time together. Obviously, you got to get permission from parent and all, but once that's done, we've done it. We have chapters all around the country, and what we found very exciting is, they're looking for control, they're looking for identity, they're looking for folks who can share what they go through. So we had, folks from San Francisco connecting with folks in Miami. We had from Boston to Houston. We have DC to Minneapolis. And as senior leadership, I connect with folks in France, in Germany, in Haiti, in different countries, and it was just bringing so much life and energy. And so, don't undercut the power of technology during this particular time. We can make it to our advantage if we use it well enough to really connect with others. Do connect, do create opportunities to do so. Another tip that we can help to our teens to cope with this is, and maybe not necessary for a lot of our younger teens, but I think older teens. And I think last time too, we talked about the whole social dilemma documentary, but this is pertaining to sort of COVID and the pandemic. And maybe less now, but at the peak and even most recently, and even a lot of folks still do, we follow coronavirus news essentially religiously. We follow the news more than we attend virtual mass. We follow the news more than we attend the Wednesday audience that Pope Francis give every Wednesday in his catechism. We follow the news more than literally the Rosary Prayer or some of the other things that are more beneficial for us. And as I talked about last week about the sort of the human faculty, if your bandwidth is say thus much, and you saturate it or you overload it with so much news, and often news are, frankly, there are a lot of negative news, and you load them up with all this negative news, there's really very little room for you to process all the good things that are happening. And so I would invite folks, and even have your teens spend less time on watching the news or on social media, because then they'll just feed you negative things that you often are clicking on and relate to. We did a study. Staying abreast of current events is very important. And I'm not saying no news. I'm saying do so in moderation. We did a study, and we had folks who listened to podcasts or to sort of 30-minute worth of news for the day. And we compared with people who listen to news throughout the day, like literally top to night. You open CNN's, Fox, MSNBC. And then we assess the level of knowledge of the news around the world. Identical in terms of folks who tune in to news for 30 minutes and get all the highlights and get all the key news versus someone who's spending the entire day on the news. And that's to tell you that you don't really need hours and hours on the news or on social media just to get whatever it is you need. You can do so in very small amount of duration. And when you're able to cut that time out, guess what? Now you have additional time to focus on a lot of things that you want to do, to focus on all the good things that you want to do, the bandwidth to process all the gratitude that everyone has been mentioning earlier on in our chat box, right? So that's another tip that we can help our teens. All right. And the last three key here, right? And this is really free to you, courtesy of the diocese. And this is evidence-based. It doesn't cost you a dime to do, but it helps you significantly in your ability to cope and manage with everything that's going on. And I would invite you to share this with your teams. These next three steps that I'll share. One, breathe. I think God, in His ever-loving, vision, creation of the world, He put us here, and guess what's all around us? It's oxygen, right? All around us is oxygen. And when we breathe in, it helps us, not only to stay alive, to feel calm, and to sort of feel everything else that's going on. But how often do we truly take a moment and what I call deep breathing? I know you do breathe on a everyday basis, but how often do we take it up a notch, Emerald, and really deep breathe? If I was to ask everybody on the line here, what happened right now if you stop breathing? Go ahead, type in the chat box. I'm sure I'm going to hear you die, you get knocked unconscious, you pass out, your pulse will increase, okay, you die. Very good. So those are the three common, right? Knocked out unconscious, you die, you pass out, panic will set in. Very good. Turn blue. Oh, that's a new one. Good. I invite all of you to do that right now. Let's see if you're gonna die. So stop breathing. Just stop. Don't breathe. And you will find out that you can't, right? It'll come to exactly, Rosemary, thank you. You will start breathing again. Your automatic system will kick in and you will naturally breathe. That's how much God loves us. That's really how much God put heirs here for us. But you know what? He wants us to meet Him halfway and not to do everything for us. So we just breathe in day to day, but let's take it up a notch and breathe deep. And this is what I mean by breathing deep. So I invite all of you to do the same. You can sit right there, wherever, just get into a comfortable position, sit, stand, wherever. Just straighten out your back and your lung, and inhale through your nose. Very good, Rose. And exhale out through your mouth. And one more time. Very good. Breathe in deep And exhale. Those of you who are doing it, I'm sure that you will feel calm. You feel immediately a sense of relax, right? Now, you don't have to be a medical provider to do that. I would invite you to do that with your teens. Have that exercise. And go ahead, tie it to religion, through his most ever loving grace. He blessed us with air. And if you reference Genesis, to give life, God breathed air into our ancestors, right? And so air is there for us. It is intended to keep us alive, intended to be one with him. And so breathe, take deep breaths in. And so here's the challenge. When's the last time that you breathe in deep in the sets of 3 for folks on the line? When was the last time you did that? So if your answer is today, give yourself a clap or a pat in the back. Well, just now, Nick. Gotta be Nick. He's our winner from last time. Let's see if he can keep up this time, right? So other than just now, right? If your answer is you haven't done this in a while, you haven't done this last week, or you haven't done this in a month, we can't pour out from an empty bottle. We can't pour from an empty cup. So in order for us to accompany our youth, we have to have our cup full so that we can pour to help. But if we're not taking care of ourselves, we're not practicing this, and we're not being well, being one, being grounded, I think it's hard for us to get into that mindset. And so I invite you to do so. If you're doing it every day, excellent. If you have a Fitbit, some Apple phone, Android, BlackBerry, flip phone, whatever that you have, remind yourself. And there's a reason why I use this picture as a thumbtack with a note. And I invite you to print it out, put it on top of your computer, put it on your workstation, put it in a card, handwritten note, and send this to your teens and say that you care, that you're thinking of our teens during this time, and revive this whole, this romanticism regarding handwritten note. I think we're so used to the email. If you're able to send a handwritten note to your team on a personal note, I guarantee you they'll save that note for a while. Versus your email, it may go into a delete box or just sitting there. And so do that and remind your teams to breathe. When I was working prior to this current job, I was with Quantico Marine Corps, and when we train our Marines, they're a tough bunch, and they're constantly in the front line all the time. And one of the exercises that we teach them is exactly what I shared with you here. We show them how to deep breathe, and then they learn because they deal with stress constantly. And so I invite you to do the same. Though they don't call it deep breathing, they call it, I don't know, tactical breathing, something to that extent. But we can change it and call it God-loving breathing, if that helps for us as Catholic to talk with teens. So breathe. All right. Second, help our teens and help our youth to sort of reframe and change the way that they look at the world right now, right, for the better. Because a lot of time, again, we feed ourselves with all these negative, maladaptive thoughts, these narratives that are constantly playing over and over again. And keep in mind, thoughts leads to behavior, right? If you think about it, it's going to impact your behavior. And then behavior will lead to emotion. Sometimes thoughts can lead to emotion, but then behaviors, how you behave, impact some consequence, whatever that may be. And so help our teens to sort of reframe how they look at everything. Often we hear them, these phrases I hear all the time, during this pandemic, maybe I'm not doing enough. Well, maybe I am doing enough just as I am. I'm doing what I can in my capability. This pandemic seems like it's going to be ongoing, and I can't get through this. We're on a second year now, and I'm missing out my graduation again. And I hope to remind them that this too shall pass. This too will be on. Something like this happened 100 years ago, and we certainly got passed through that. And just to think about it, I took some time to pause and reflect on. It's about a year or so since the whole pandemic. A year later, we got a vaccine, and we're curing, distributing that around the world. To me, I think that's medical miracles. So it takes some time and pause and say, you know what? we can get through this, and give some concrete evidence to help our teens kind of see things through. I'm at home, I'm in prison, or I'm stuck, I can't go anywhere. Reframe it. We're playing a role in preventing the spread of the coronavirus. Maybe we're taking an active role. We have elder parents at home. We are helping them from contracting the virus. Just this morning, I had to work with a patient that we had to medic back from India who died of COVID complication. So it's no joke. It is out there, and folks are being impacted by it. And so reframe how they see things. Here's a good one I like. I've lost all of my freedom. Well, maybe, you haven't lost it. You're doing this for a greater cause. And during the time that you have, let's focus on things you can control. If you miss the things that you love, let's count our blessing, count our the grace that we have. So reframe, turn the way they look at things. And then at this point, if I invite folks who are on the line, join with me for a second. This is a good exercise you can show your teens. And invite your teens. If they're on Zoom, they're in front of you. Most likely they're in Zoom. Have them point their finger up. So I invite all of you to join along. Feel free. And so if you point your fingers up and you're looking top down at your fingers, keep it low enough so that you're looking top down for me. Not so much high up. Keep it low enough so I'll stand up so you can see. So you're looking top down from your fingers. And if you look at the tip of your finger, and if you spin it clockwise, right? Clockwise, which is to your right. And if you look at the tip of your finger, you will see that your fingers are going clockwise to the right. Now slowly keep spinning the same direction. Don't change. Slowly rise your finger up, past your chin, past your nose, past your eyes, and point up to the ceiling. And now look at it. What direction is it spinning? Look up, look at it. What direction is it spinning? All right. I see some smiley face. I see some puzzled face. It's spinning the opposite direction. It's spinning now counterclockwise, right? Not only am I a psychologist in the youth ministry, I'm also a magician. I'm kidding. No. So all it is, the only thing that changes what? Is perception. One, you're looking from bottom up. The other one, you're looking at top down. I still see some folks spinning, so that's good. We can do this after. I'm almost out of time. We'll do this later on. But right, help our teens, right? To kind of see if we choose to look at the world through a lens of negativity, of Satan, of nothing that's good, and that's all that we'll see, because negativity will attract negativity. But if we look through the lens of God's grace, of blessing, and all His blessings in disguise. And next week, we'll talk more about how to turn to faith to cope with that. But if we look at through a positive lens, then we will see the world in more positivity, more positive energy. And positivity will attract positive energy, right? And, I share this with a lot of folks. The difference between a good day and a bad day, a good pandemic versus a pandemic, is really internally how we look at it, our attitude at things. So last but not least, another powerful tool. So the last three that I've shared with you, all of these have been evidence-based, and they've been researched this, and they have shown that if our teens participate with this in a regular basis, it will do them wonders, will help them significantly. And so the whole idea is, blessings, God's grace is all around us. Do we take the time to thank Him and to appreciate the blessings that we've given? Or are we constantly criticizing Him for the things that we don't understand, therefore hurts us emotionally, and it distances us from Christ? And so this fourth wave of psychology, what we call positive psychology, and all of this is just gratitude. If every day, research has shown, if you just take a moment and just identify one thing that you're grateful for. And then it doesn't have to be something big, something grand, like you won the lottery or you're still alive. It could be something small, something minor, something you just observe. You notice a smile on the teens. You're grateful that teens who've been missing out in the last 3-4 weeks decided to show up. So those are the things that we want to be grateful for, and help our teens to do that. So this is what I did with our teens that I've worked with. I gave them a stack of the sticky stick. I don't have one with me, and then challenge them. And I invite you to do this for your youth ministry every day. Start with, today I'm grateful for and write it on and then stick it on your wall. And by the end of the 200 or 300 of it, I guarantee you, you will see a transformation and sort of an encountering of God's love as they go through this. And I invite you to do the same. We did a study too where we took a group of folks who just journal, just your random journal, things they do in the day. And we paired with someone who journal but with a gratitude focus. And their quality of life, their ability to cope with stressors, it's just, uncomparable, statistically significant. And so I invite you to do that. And so now as you're on the line here with me as well, I invite you to do the same. Go ahead, type in the chat box. Just start with today, something that you're grateful for today, and then be as specific as you can, because we want to look at sort of God's work in all that we do. I know the air and the oxygen, being alive and having a job, that's great, but I invite you to look deeper and really discern God's gifts. All right. My life with family, beautiful. Cool breezes today, excellent. Well, here in the DC area, we got some rain today. So nature, good health, conversation with student about human dignity. Amen. Theology of the body. The crazy cat. I take it, it's good. Smile on the daughter's face. Flower, quiet, grateful to hear from an old friend. Beautiful. That's always excellent. Daily mass with a wife, best friend, thankful for family and friends. Beautiful. All this is great. Beautiful walk around. My faculty who came to work today, listen to Bible in a Year podcast. Great to be living by the ocean. Nice. Next time we're gonna have the retreat there, wherever you're at. Joy of pets, family and friends, seeing staff, working hard through the end of the school year. Quick note from a student. Excellent. Here and nephew. There you go. And if you haven't done this, and us as adult, obviously we don't have to write it out, but there is a science behind journaling with gratitude. But I would encourage you to invite your teens to do this. My daughter, she's only 8, she just turned 9, and when she prays, it's hard for her to pray. She doesn't know how to pray other than reciting the Our Father, the Hail Mary, and Glory Be, which then that can become very perfunctory, very robotic, right? So I started working with her to kind of help her to count her blessings. So every night I said, when you pray, just thank God for the people that you interacted with today. Thank God for something. And that's really her prayer. Thank God for X, Y, Z. And then she's doing that. And she just happened to be right here. She just walked down. Want to come by, say hi? She's shy. All right, so good. Practice gratitude. Okay, very good. While I love all of your comment, I was a little bit disappointed. No one said, hey, I'm so grateful for having this awesome Asian guy here with us today for the presentation. Just kidding. All right. And last but not least here. All right. And so, sometime, and I borrowed this from Indiana University, but sometime we as a society, I think we as a community, we often look at reaching out for help as a sign of weakness, depending on the cultural makeup as well. And then stigma get in the way, and this is where I am, Michael, in the chat box. And then this is where I'm inviting all of you to be the advocate, to be sort of our, ambassadors, to encourage folks, to encourage our teens to talk to us, to reach out, to build that bridge when needed. Because reaching out really is a sign of strength. To be able to say, hey, I'm going through with this, and I can use some help. If you think about it, our whole confession, our sacrament of reconciliation, that is reaching out, right? To recognize that we need help, and then we reach out to ask for help. That is strength. There was a story about a young teen and his dad, while at home, dad gave him a chore, and the chore was, son, you need to go out there, help me. In front of the house, there's this big boulder, this big rock that it's too heavy for me. I'm old, but you're a young guy, you lift weight, you play sport, you're in football. I need your help. So go out there and help me move that rock to the side. So the son went out there and, he flexed his muscle and he tried to move the boulder, the rock, but he couldn't move it. It was too heavy. And he came in and he said, Dad, I'm sorry, it's too heavy. I can't do it. The dad says, son, you are not using your strength. Go, use your strength. And so the guy thought, well, maybe I need to use my brain power, right? I needed to use my brain a little bit. So he went out, he got a little stick, he tried to build a fulcrum, trying to lift it and trying to do all of that as well. And he couldn't do it. And he went in, he's a bit disappointed and frustrated and said, Dad, I couldn't do it. I don't have strength. I tried, my muscle was not strong enough and I used my brain, I used science, physics, I couldn't do it. And Dad said, son, you haven't asked for help. And so the son asked Dad for help, asked the neighbor, asked the other neighbor, asked the whole community. And when he reached out and he asked for help, everybody got together and they were able to push the rock, the boulder away. And so really the bottom line to that is really it's, illustrate and help our team to be able to connect on a sort of on a teens level. If we talk philosophical up here, they sort of won't relate to it. But if you talk sort of on their level, give analogies, give stories, that would help our teens understand. I think there's a reason why I think Jesus, his teaching, part of his style is to use parables, to use stories so that people can understand. And so I think with our teens, it does the same. All right, so that's look, that's listen. I know I'm running out of time because this sort of, like I said, is the bread and butter of the talk. So the last L, it's really to link, right? What do we do? How do we link to referral and resources? And so once we look, we observe, we see some signs that would be indicative that our teens is going through a hard time. Accompaniment is through listening, active listening, empathy, asking the right question, and helping our teens with coping skills that we just talked about to deal with this. And as we're going through, and if it rises to the level that's really beyond our scope, that's something that's beyond our ability, then we're at the point where we want to link our teams to resources, to services. And now linking can be as simple as, maybe if I can help you call your parents, I'd like to be able to do that. Or if I can help you call your uncle, someone maybe can talk to your parent if there's some family conflicts going on. Or maybe, perhaps, maybe better we sit down with our pastor and we can help facilitate that. Or if you and I can have some alone time, we can talk, or with others, or if it rises to the clinical level. And so here I just put some outline of the different resources that you can use within your county, within your city, wherever that you're at. If it's from a mental health angle, I think last week I mentioned Catholic charities, depending where you're at. A lot of time they do have a very excellent mental health support program that's Christian-centric, that's Catholic-based. Some of these free national hotline that we have, that's a suicide prevention. And that in itself is another talk, just recognizing symptoms of suicide. Crisis text line that you can text, it's free, confidential. There's a substance abuse and mental health service agency distress line that's for alcohol and drug use or other mental health related. If you're experiencing domestic violence, that's also another hotline. And a new line now for parents dealing with all sorts of struggles. And that may be helpful. And so all of these are available for you. And this may only be limited to the national level, but locally, jurisdictionally, whatever you have, make good use of it. Keep that resource available so that you can link and connect your team to services. Okay. So hopefully, in a nutshell, I know we're time for 90 minutes, and I sort of just nailed it right there by 8:30, the beginning to the end. I still have that activity that we could do at the end, but in respect for folks' times, if you want to head out, you can. If you have questions, we can ask at the end, or if you want to stay for the cool game. I think it'll be exciting. I invite you all to stay. It's really a creative way to integrate social interaction with biblical interaction as to how we bridge or how we engage with our teams. So I'll pause here, and once again, thank you everyone for joining, and hopefully we can connect again next week. Dan, right back to you. If we have time for questions or we can do the games, you just let me know. I think you're on mute, Dan, and I think no one else can talk, so no one can really say anything. There we go. We can hear you now.
Okay, thank you. I was just saying that you did such a beautiful job tonight of helping us know how to be truly present to our teens through the listening and empathy skills, but really powerful takeaways with our own self-care and how we need to take care of ourselves in order to serve others. So I just thank you for that. I'm personally taking away the looking through the lens of grace. That is beautiful. I have a 10-year-old daughter who just started journaling. I will talk to her tonight about journaling with gratitude. So as a father, I thank you. I thank you for that as well. Again, in the interest of everyone's time, perhaps perhaps we could pray, and then those that would like to stay on, since you're willing to either play the game or to ask some questions, we could do that then. But let's officially end so that people can step away. Are you comfortable with that?
Very good. Thank you, Dan. And thank you,
Okay,
everyone.
great. So I will attempt to share again, and let's hope that please. Oh, here we go. All right, very good. Very good. Okay. Just like we did on our last gathering, I'd like to just end with lifting our intentions up in this year of St. Joseph, seeking the intercession of St. Joseph. And I thought tonight we'll just take a moment to pause and think maybe less about the teens we serve, and thanks to Young's invitation, we will think a little bit about our needs. What do we need to remain strong in our faith and our resolve and our ability to truly be present to our teens? So I invite you, just with a quiet moment, to call to mind those intentions. And let us pray. In the name of the Father, and the Son, and the Holy Spirit. Amen. So from wherever you are, I invite you to share this prayer with me. Hail, guardian of the Redeemer, spouse of the Blessed Virgin Mary. To you God entrusted his only Son. In you Mary placed her trust. With you Christ became man. Blessed Joseph, to us too, show yourself a father and guide us in this path of life. Obtain for us grace, mercy, and courage, and defend us from every evil. Amen. In the name of the Father, and the Son, and the Holy Spirit. Amen. So just a quick reminder that we have, there should be a checkbox on our May 24th one. As we've completed that, we'll be back on Wednesday, May 26th. Not next week, but this week, May 26th at 7 o'clock for the third and final segment with Young. I truly invite you to come to that one and invite all your friends. And we hope that we'll see you again on Thursday. So thank you for being with us tonight. We will officially end, but thanks to Young's generous invitation, if you'd like to stay on to close out with the game or to ask a couple questions, we invite you to do that as well. So I will stop sharing as my device has let me down today. And thank you again for being with us. God bless you. And I'll turn it back to you, Young, for the game. Looks like most folks want to hang on and play.
Great. Thank you. Thank you. All right. So can everyone hear me? Can everyone see the screen? Perfect. All right. So the person to beat tonight is it's Nick. Okay. And basically all of this is on a honor system. So the first one who can type in the chat, so make sure you have access to the chat room available, and I'll just call the name of whoever got it right, and then you just tally your own point as much as you can, and at the end of the presentation, which on Wednesday, and we'll just tally up at the point. Whoever has the highest point, I guarantee you, I'll have a very special gift that it won't disappoint. I can certainly share that. And then maybe on Wednesday, at the beginning of it, I'll announce what that gift is so that you're more tuned into. Actually, maybe I'll share it now and it'll entice you to come back. on Wednesday. The Holy Father, every time he meets folks or interact with people, there's a special paper rosary with his coat of arms on it, and that he would give out to folks. And so I happen to have one, and I would have that be the gift for the winner of this event here. He gave me one, but I asked for a couple, so I'm not giving up my own. I have one, but then I also have an extra. So, and it's been hand blessed by the Holy Father. And so what I'll do is that'll be the winning points for folks. Okay. All right. So here we go. Can everyone see the main screen? All right. Do you see Bible trivia? Right. Okay. All right. So what's going to happen is, and at the end, I'll sort of tie this into how we use this with our youth. And so if you see, and I'm going to give you a hint, and keep in mind, I made this on my own. So here and there, maybe not at all accurate, but just bear with me and then play along. But I will give you a hint. And if the hint, whatever it is, it's in bold, it is a hint to a candy that many of us do know or may have eaten, or our kids or our teens eat. Go ahead, such as M&Ms, right? I don't know, name some other candy, Snickers, what happened, right? And then Mounds, very good. All right. And then if the hint that you see, it's bold and italicized. So not only bold, but also italicized. It's a hint to a type of chips, snacks, so like potato chips or some other chips. So we have Doritos, I don't know, give me a Lay's, give me another chip. There's a bunch of other chips. I'm purposely not wanting to name them chips because they're the answers to all these on here. And then if it's bold, italicized, and underlined. So if you see anything that's underlined, it's a hint to a drink or beverage. Okay. And for the six, we're working with teens. They're all non-alcoholic drinks. Okay. All right. So we ready? And then sort of tell a story. And the fastest one to type in the chat box. Okay. Now just look here. In the beginning, God, also known as the Holy Trinity. Trinity is the hint. Three-sided shape, strongest, created the universe. Doritos. Oh man, I'm telling you, you all need to beat Nick, okay? Because he is back and he's on fire. So Nick, point. All right. Very good. So that's where's my mouse? Doritos. Very good. All right. And then within the universe, there are many galaxies, and our galaxy is, so it's a hint to a candy. Milky Way. Nick, first again. I swear, Nick does not have access to the slides. He does not. All right. And then within our galaxy, there is one special star. Chip, into a chip. One special star. One special star. Haven't seen it yet. Sun chips. No, wait. Sky Huan. Oh, wait. That's my daughter. She's joining in. All right, Sky, let's be charitable and let's have others. But you can tally your own point, okay? All right. So Catherine, point for you. Sun chips. Very good. And then and this star, if this star explodes, we're doomed. Star explodes. Hint to a candy. Starburst. Nick, very good. Starburst indeed it is. All right. And so God created the world in this amount of days. Is a hint to a beverage. It's Jen helping Nick. I don't know who Jen is. 7-Up. Who's first? Nick again. Very good. 7-Up. Very good. And on day 3, God created the oceans and blank. So it's hint, land and uneven land. Uneven land. I'm drawing hands as a hint here. It's a beverage. No, not Miles. Miles candy. Mountain Dew. Very good. Cyril, if I pronounce your name wrong, I apologize. Mountain Dew. Very good. Point for you. Keep that. All right. On the 5th day, he created animals. For example, he also created these. These were there. Double lizards. That's a hint to a drink. Not Gatorade. Double lizards. Sobe. Very good. Nick. Not only he's good with Bible, he's also a candy eater and a beverage drinker. All right, Sobe. And then God also created animals, leopards. Hint to a chips. Leopards, chips. Anybody? Cheetos, Catherine. Oh wait, no, Bob got it first. Bob, I apologize. Bob, very good, Cheetos. And also gives you wings, this kind of animal. is their slogan. Red Bull, Nick, you got it. Very good. All right. And then crocodiles, part of some of the animals are crocodiles or relatives of the crocodile. Gatorade, and very good. Gatorade. Excellent. Good. And so he also created human in his image. Oh, wait, go back. Did I miss some? No. He also created human in his image and placed them in the tropical Garden of Eden. All right. So it's a hint to a drink. Tropicana. Oh, wait, that's my daughter again, Sky. Sorry, she's taking away your answers. All right. So Sky, point for you. All right. So Tropicana. And when God created human in his image, he created many different types of people. For example, there are those who are very good with sports, such as those who are professional in baseball. Baby Ruth, very good. Nick, point for you. Baby Ruth. Or those who pursue and be an MD. It's a hint to a drink. Dr. Pepper, Catherine, very good. And then there are people who are very, very, very book smart, slang for book smart. Hint to candy. Nick, nerds, very good. Excellent. Or smarties. Actually, smarties, another answer is as well. So we'll give Nick and Catherine points. Very good. All right. And then there are people, but really nothing but, oxygen in the head or O2 in the head. Airheads. Nick, very good. All right. And then there are people who, always whine like children. Hint to a candy. Crybaby. Lynette, excellent. Very good. Very good. And then there are those who, often are violent, which we need to pray more for them. They like to go around, punch people in the chin. I guess Jawbreaker, Lynette, very good again. The new name now is Jawbuster, but Jawbreaker is it, right? And then there are those whom God created, they're destined to be knights. Candy, hint to a candy. Knight, Three Musketeers, very good. Nick, awesome. And then human began to sin. And so God sent the great flood with strong tornadoes. And that's where we got Noah's Ark. Twizzlers, so close, not Twizzlers, something else, Twisters. I think Bob gave Nick the hint. Twisters, sorry, pictures, bad pixels there. All right, and then after the flood was over, there was a rainbow signaling that the flood is done. Rainbow, Skittles. I think Dan, very good. So Skittles. And then, Noah on the ark came out and he freed a pair of doves, ready to test the air, to fly around. Candy, pair of doves. Oh, did I say doves? Dove bars. Very good. Doves, candy. Whoever is first, all right? I can't keep track. Many people are typing in. All right. And then mankind, we continue to sin. So then Jesus was born and was situated in the manger. Situated. Chip, hint to a chip. No. God himself, Jesus came down for our salvation. Lays, Richard, very good. Very good, Richard. All right. And then drummer boy celebrated with loud musical instruments at his birth, along with the angels. Music, bugles, Nick, excellent. Not many got that, excellent. All right. And then he continued with his preaching, and then really, ultimately he died on the cross for us so that our lives can be saved. Candy, lifesavers, very good. Nick, excellent. And as he died on the cross, two ladies were beneath him, Mary and Mary Magdalena. Candy, Eminem, very good. Richard, awesome. And then, if we live according to God's teaching, we do what Jesus has taught us to do, it will do our body good. Or it is the slogan, it does the body good. Milk, very good. Catherine, I believe that was first. Excellent, milk. And then if we live according to his teachings, we will be rewarded on that day in heaven, in his kingdom. The end. Payday, Nick, excellent. Very good. All right. Congratulations. I don't know. It seems Nick is falling behind a little bit. We got more people there, but concerning with last time as well, Nick may be in the lead still, but we'll see next week. And so I share that to illustrate an example. I think with our teens, we go straight in right away, talking about religion, talking about God, talking about the Bible. We may not yet be able to connect with them right away. And so in our youth ministry as well, what we do with our games, we call it Bible-licious game. Any game that you can think of that you play, for example, Scouts in the community, we take that game, we integrate it, and we put Bible content or lessons in it. And so now they're having fun, but at the same time, guess what? They're learning about the Bible. And so as I did all of this early on, next time when you look at Payday, you may think of, doing something good. When you look at Eminem, you think of Mary and Magdalena, right? You look at the Doves, you think of Noah freeing after the flood. You look at Starburst, it's not just candy, it's really God's creation. And so the more that we're able to do that, now we're bridging, we're speaking their language, right? We're at sort of what they do or what they're familiar with. And I invite you to do the same. For example, capture the flag. I see this game all the time when you have field day, when you have things like that. In our youth ministry, Eucharistic youth movement, we never play capture the flag. We'll play rescue a soul from purgatory. Similarly, running up to get the flag, but we don't call it the flag. We say you're going to run up there and rescue a soul, right? And so that's how we play. And now they're learning. And why are we doing that? Because that's our duty. That's our the dead. They can't do much good anymore. But we, as folks who are alive, we have a duty to pray for them. So if I'm teaching the 10 Commandments, right, I can still do that. But instead of having number 1, 2, 3, 4, 5, 6, 7, 9, 10, and you called 1 to 10 to come up to get the flag, we play. You know what? I do this with kids. So the teens say, I don't want to learn. Learn is boring. I said, you're right. We're not going to learn about 10 Commandments today. We're going to play today. And they get all excited. I say, what are we playing? We're going to play 10 Commandments. And so we line them up. We appoint each one with one number, and we tell them what that commandment is. So now I'm not going to call number 1, 2, 3, or 4. I'm going to call what the commandment is. And you need to recognize that. You run up, you capture the flag. And so I invite all of you, take any game that you can Google online. Be creative. Infuse in our beautiful religion. There's a lesson there to be taught. And I guarantee you, the youth are going to be able to connect. The teens going to be really connect with you and see how relevant that is. And that's how we connect and how we journey. We build bridges. All right. So with that, thank you everyone for staying back. I know time is precious and it's about almost 9, but you spared me 25 or 20 minutes or so to say after, and I'm grateful. So thank you once again. Have a most blessed night. And I will see you all on Wednesday to wrap up. And I'll be sure to end early to put more time for questions at the end. Watch it. All right.
Thank you, Young, so very, very much.
Thank you, everyone.
And thank you, everyone, for staying on. God bless you. See you Wednesday.
Take care. Bye-bye.